Hi, I'm Dawn Damari, and you're listening to and watching another episode of A Teaspoon of Healing. I am happy to introduce my guest for this episode, Fredric Schiffer, MD. He's a psychiatrist, a part-time assistant professor at Harvard, a speaker, and a best-selling author. Hi, Fredric.
Hi, it's a pleasure to be here. Thank you.
Oh, thank you for coming on the podcast. Hi, Fred. I hope you're enjoying your day. So, would you mind telling our listeners briefly, just a brief summary about what you do?
Okay, I'm a psychiatrist with a clinical practice over decades and also a researcher at McLean Hospital at Harvard, where I have come up with a novel theory of psychology that has many clinical applications. And I can explain it briefly. What I have discovered is that all psychiatric problems that I have ever encountered, that's the whole gamut, come out of traumas. And often the traumas aren't recognized. And so the traumas don't have to be war or sexual molestation. They can be that, and they are horrible traumas. But most of the people I see in my Boston suburban practice have childhood traumas from a dysfunctional family, with a mother who tells her son when he's in diapers, "You'll never amount to anything. You're a failure," or divorce or an absent parent, a bullying sibling. And then that leads to new traumas. When they go to school, they bring their trauma from home, and they're kind of more introverted, and they get picked on, and that becomes a new trauma. And then they get in with a bad group, and then they get into alcohol and drugs later. Mm-hmm. And by the time they get into substances, they see that they're a substance abuser, and they forget all about the trauma. And I like to say I don't have any substance abusers, opiate addicts, or alcoholics in my practice. I have trauma victims who turn to that, and people turn to all sorts of things to deal with their traumas, and most of them are not helpful or very destructive. And so what I found is that the trauma seems to get located in one brain hemisphere. And it turns out that each brain hemisphere can support a whole mind. And you can remove a brain hemisphere for cancer, say, or neurosurgeons have a procedure where they put half the brain to sleep with an anesthetic agent. Mm-hmm. And the personality can change in a lot of people by putting half the brain to sleep. And so I developed a technique for stimulating one brain hemisphere or the other, and it's so simple that it's shocking. And I want you to try it if you would.
Okay. Oh, okay. And I read a little bit online about your theories, which we'll talk about, and how to try it. I'm wondering if it's going to be the same thing. I found it really interesting. I was reading a lot about it last night, and it's really fascinating. And I know as we had talked,
mail?
Do I have any junk mail? I do, but it's upstairs. I don't. Let me.
A credit card or an iPhone or anything?
I have an iPhone. I can use. Okay, let me grab it.
And I'll show you what to do. Cover your right eye.
My right eye. Okay. It's okay to have I have my glasses on.
And then keep your glasses on, and then move it over to cover half your left eye. So you're looking out the left half of your left eye.
Right.
Okay. Yes. And it turns out that we have an fMRI study that shows that this actually activates your right brain.
Yes. Okay. I was reading about this last night. And now, do you have to cover the bottom part too, or is that coming next? Okay.
No, you don't have to. This is all you have to do, and people can try it at home if they want. And so, what I would ask you to do is to maybe think of something that's somewhat upsetting. I don't want to traumatize you.
No, let me think, because I'm in a good mood. So I can certainly think of something. Well, there's a lot going on, so sure.
Okay, and then
Yeah.
And this occurs within seconds. So I want you to evaluate how much distress you feel, or whatever you want to measure, anxiety or whatever, from 0 to 10. Do you have that?
Yes, I do.
Okay. So now I want you to do the opposite. So we're going to cover the left eye
Okay,
and move it over. Now, a lot of people look out the whole eye, and that doesn't work because it goes to both hemispheres. But if you move it over, so you're looking at the lateral half of one eye.
Okay.
Now we're looking at it's called the right lateral visual field.
Right.
And now I want you to think about the same incident, or the same whatever you found problematic, and rate from 0 to 10 how much distress you feel.
Okay, I did.
Okay, and so you put it down. So that's it. So was there any difference between
There was.
one side?
There was.
How many points was the difference?
Well, the point was about 3. I know from this side, which is probably the right side of the brain, it was still a really traumatic thing I was thinking about, but it was worse from this side than this one. So this side, it was about, and I tried to get it lower just because I felt like, gosh, am I insensitive? I would say it was a 5 to 6. And here I would definitely say it was an 8 from this side. And so this side, which is my right, activates the left brain. Yeah. The left brain. So it seems like for me, the left brain, and I tried this last night as well. Yeah. And I did the same thing. And the left brain made me more upset. Whereas when I used this, when I shut off this eye and then I looked out of my left eye, which is the right side of the brain, it felt more, I don't know if that's the logical side of the brain. I don't know. I did not get as upset.
In other words, that the left brain may be more logical and the right brain may be more poetic. But also, the left brain controls the right arm. Okay, so there are a lot of we're looking at another function.
Okay, so this arm here is controlled by the left brain. Okay, so but each brain can be logical.
Generally, there's truth to that, but it may not be complete. And what we're doing is we're looking at something different, just like a hand movement is different from speech, or it's different from emotional feelings. This is personality. And that on one side, there's more of a troubled personality that's more childlike.
Oh, okay. So for me, that's definitely the left side then. It must be, because I tried it again. I tried it also last night because I had read about your theory, which is really interesting. And it did the same thing. It was I thought of a different traumatic event or memory. And when I was looking at this eye, so this side of the brain, the right side, I did not feel as upset. So both times. So it says, is that something within my personal trauma? It was the same as today. Yeah, it's the same as a different event. This side seemed less upset than when I was looking at this eye, which is this side of the brain. The left got more upset both times.
Right. So now everybody thinks that the left brain is your happy brain and your right brain is your depressed brain.
Oh, okay.
But that's not. I find that not to be true. And that in your case and in many people's case, the left brain it carries the trauma. Okay. And when I say that, what I mean is that when you look out your right visual field and stimulate your left brain, it's more like the little girl inside you is looking at the world through her trauma. So it's all kind of, oh my God, the bad things are going to happen. And out the other side, it's more realistic or more adult-like. Yes. And I can handle that. That might be a problem, but I'll deal with it. And this then becomes the basis of what I call dual brain psychology. Okay. And if I promote my book here, that'd be great. It's called Goodbye Anxiety, Depression, Addiction, and PTSD: The Life-Changing Science of Dual Brain Psychology. And it's on Amazon.
Oh, it is. Cool.
And it's a fun read. It's not a heavy read, but it's substantive. It's not a just scratch your elbow and you'll feel better. It's kind of it goes really it's really interesting about how the mind works, actually, and how trauma affects us and causes these problems. And then it leads to solutions, depressed mood or feeling anxious or having trouble because, things are piling up. You can take your iPhone now and look out your half of your left eye. And within a few seconds, you'll feel better. And it's like your whole view of the world has changed. And as soon as you can say, no, I can handle this, that changes everything. And it gives you a feedback that then changes, and it can stop the anxiety right in its tracks.
Wow, that's incredible. So if I'm in a situation where I'm feeling anxious about something, I can cover. So for me, it's going to be different for anyone listening. It's going to be probably different for them. So for me,
and they can figure out which side is their better.
So for me, it'll be I'd cover with an iPhone or a piece of, like you said, junk mail or anything.
Right.
Cover up.
And we have sunglasses that we're going to market.
Okay.
That you can wear. They look nice, and they'll do the same kind of stimulation.
Oh, okay. And so then, now, when you do it, you have to cover. So you cover right eye and then part of the left eye, or vice versa.
Yeah.
So okay.
And the reason is that each eye goes to both hemispheres.
Right.
And if you look out the left side, it's stronger. It's divided 60-40, and that's why.
So even if someone has poor vision in one of the eyes for some reason, this would still work.
It still works, yeah. And then we have an LED that we put on the forehead. If I have it here. So this is an LED that we put on the forehead, and cool. We have a $2.5 million grant from NIH, nice. Which we're now completing the study, and we're treating fentanyl addiction. Most of the participants had like 3 overdoses before they came in. Most of them are doing really well. And we think the people who aren't doing well are getting the sham treatment. Now, we don't know that.
I see. So there's a control in there. There's like a placebo or a control.
It's a double-blind placebo.
Great.
And it's for the FDA. It's for and we have a breakthrough designation. So we've got serious science with this. And we have about 25 papers published on different experiments at Harvard that we've done to support it.
Well, that's wonderful. This is really, really exciting. Yeah. There's a lot of people I know listening that are either very interested in psychology, like I am, and then I have, like I had mentioned before, we had talked. I have a family member who works in this field, so I'm sure they'll find it interesting. This is really interesting. Now, so when I was reading about your work and your bio, and just speaking to you today, depression and anxiety, there's a big relationship between those things. And past traumas. And I'm assuming addiction too, but I guess mainly first we talk about depression and anxiety. So the link is really with the past traumas, either childhood or just in your past.
Yeah. Now it could be if someone's living in Gaza or Ukraine, they wouldn't be normal if they weren't depressed.
Of course.
Okay?
Of course.
So what I deal with as a psychiatrist is old traumas where the person doesn't realize that they're not in Vietnam anymore. So it's a different thing. If I were trying to get somebody to cope with being bombed, that's a harder task.
Yeah, it's really impossible not to feel depressed or anxious all the time.
Exactly. And so depression is actually a normal feeling. It's just that the trauma gives a perception that is skewed in a negative direction.
Oh, okay. So a lot of times, like you were saying, for example, the Vietnam veteran who is not aware, he's aware, he or she, they're aware that they're no longer there, but maybe in their mind, they still think that they're there. They can't really get past because it's so traumatic. Yeah. So that could probably be applied to a lot of people.
With you, what I do in my therapy is I have a person put on the glasses and I talk to each side. And then we would find out what that side was really upset about. And then I try and get the healthy side to be like a co-therapist and help that troubled side, because left alone, they try and sabotage each other and dominate each other and find. So some people are so dominated by a troubled side that they just wind up drinking and using fentanyl and have a failed life.
I see. So even if you're really consciously trying to think of it through a different side, so I guess one side can be more dominant. And if you have had the trauma, it seems like whatever side has the trauma seems to take over.
I would say generally that's true. And the focus of psychotherapy is to get the healthy side to dominate.
Yes.
And to be a good parent and not to just try and beat or kill, the troubled side.
True. Yes. So when you mentioned addiction, sometimes addiction, of course, I don't have any background in psychiatry or psychology, so correct me if I'm wrong. So sometimes the addiction is to cover up some of these feelings or just to numb.
I think it always is. It's just that people don't realize the connection with the trauma, and they often don't want to know it. That there's often a resistance to seeing the connection with the trauma. But I find that I have never seen a patient who had an addiction that wasn't related to the trauma. And with the light, what we do, and in this fentanyl study, if we put the light on the positive hemisphere, it enhances, it activates the positive hemisphere, and the cravings go away.
Wow. Now, so the light, it's going, so it comes, you don't have to look at, well, I'm assuming you're not looking at the light, so it just shines within, actually through the skin.
Through the skull into the brain. And the FDA has determined that it has no significant risk. And it's called photobiomodulation, which is a burgeoning field in science today. There are no known risks to it.
Oh, okay. Yeah, just I guess as long as you're not shining it into your eye, then that would probably not be good. But if you
put a laser in your eye, you'll destroy it.
Yes.
But this is an LED, and it's actually used for the treatment of certain eye diseases.
Okay.
I'm not recommending that anybody, stare at it, but we don't have to wear special goggles or anything in the treatment.
So it can really penetrate through the skin and the skull and get into the brain. That is amazing. That's really amazing. So it's stimulating the healthy side, whichever side that is for the person.
Right. And then I have a new model that inhibits the other side by pulsing very slowly, once a second. And that's to inhibit the negative side. So we're stimulating one side and inhibiting the other with the light. And that we find is much more powerful. So we have to go through the FDA and all that.
Yeah. Well, that's okay. That's good. That's the nature of studies, but this is really fascinating. So for some people, you said, for example, for me, the left side of the brain seems to be the one where the trauma is. Right. And for some, it's the right. So how does that work? How does it get stored in one side of the brain or the other?
Well, we don't really know, but I suspect that it's the type of trauma and the timing of the trauma tends to be a trait that stays with you. Sometimes I have patients who flip, and I don't know what that means. But basically, usually, if somebody's like my right side is my negative side, and it's always been. For most people, it stays on one side.
Okay, and is there a ratio of people that have it on the right? Is it usually more prominent to have the negative side on the right or the left?
Yeah, it's a good question. I think that probably in different studies we get different percentages.
Okay.
Generally, I think more people have their trauma in their right side, but that would be like 45% to 55%. So it's not that everybody has a negative right hemisphere like most scientists believe.
Oh, okay. Yeah, and that's interesting what you had said. So most scientists do believe that most people of the negative side is on the right, rather than the left. Okay.
And that really comes from studies that were done that showed there were EEG changes with depression that were on the right side, but they used average data. They didn't look at individual data. Again, if you average everything, even with my stuff, if it's 45 to 55, I would come out saying that all the bad stuff's in the right brain. But what I see is that in an individual person like you, it's often the left brain that's carrying the problem.
Is there a reason why? I wonder, does it trace back to a certain age? Because I know the left brain, okay, just growing up, I always thought that the left brain was tied to creativity and being art or emotions, and the right was logic. Oh, it is actually. Okay. So the right brain is more, I guess, so artistic and creative. Oh, well, that's great. That's good to know for me.
This is different. That if I had you look out one side or the other, you wouldn't feel more logical on your troubled side, even though it's your left brain.
Okay.
So I think that it would probably be if you had just a logic test, your left brain would do better. But we're dealing with something different.
That's really incredible. So if somebody has, for example, anxiety and they go through, I guess, the test with the phone or the junk mail, or even further with the LED. So how does that change, I guess, them in their day-to-day life when they're not actually receiving the therapy?
First, they should buy my book. It gives a lot more information about that. I teach people how to talk to their troubled side.
Oh.
Form a relationship with it. It's really like two different people. And you have to get to know it. And
this is really interesting. And so you also deal with, like you said, with addiction, fentanyl, and also gambling addiction. So what have you seen? What results have you seen working these therapies with people that have these addictions?
Well, I have an interesting story. Now, I don't see a lot of gambling addiction, but this one patient who was coming in for an opioid addiction, he was doing very well, told me he was gambling. And so I told him, I said, well, you're in luck. I happen to have a casino in the back. I said, but unfortunately, there's a cover charge. So we had an auction, and I got him up to $2,000 to pay to go into my casino in the back. And this is unaided, and then I had him block his eyes, and he wouldn't pay me anything.
Interesting. Oh, okay.
So his opioid addiction was on the same side.
Oh, that's interesting. So both addictions,
negative on their negative side.
Okay. So and that side that has the trauma is going to be the more negative side, and the other one is going to be more positive because it hasn't had the trauma. And now, so if somebody's taking either a medication or going through traditional therapy, can they also use these therapies that you're using?
Yeah.
That's great. And now, are there people, maybe, I'm not saying that I think most of us have some trauma growing up, but are there some people that don't have, that are pretty much like, they're pretty equal on both sides?
I find that when I've tried to test neurologists, they never have a difference.
Interesting, really?
Yeah, and I think that either they're so repressed or just healthy on both sides and don't have a difference.
Oh, okay. Yeah. So it's true that some people, either they may not have had traumas or they don't remember them.
Yeah, in my practice, about 15% don't respond, but usually that's because they're more repressed, and eventually they will respond.
Oh, okay. So you can really repress these traumas. That's what I've heard from speaking to other people on the show, that some people and some of us, we can really repress these traumas. And until you have therapy or some other kind of modality to really get in there, then you realize that they're there.
And if you repress it, it doesn't mean that it's not affecting you. It just means that you block your awareness of it, your conscious awareness of it, and your acknowledgement of it.
Okay. And that probably can help. When I say help, it helps people, but they still really need to deal with it. But that's how they cope, is just kind of repressing it, avoiding it, and then hoping it goes away. But it doesn't really go away.
No. Okay. Most of the solutions that the immature side finds are destructive. Occasionally, someone finds the library and as an adaptation, but that's rare.
That's really interesting. So people can eventually get to that root of their trauma and treat it, even though it's been suppressed or repressed. is there a way that other people, I guess they could get your book, assuming the studies are probably closed, but people can probably work with you. Do you work with people virtually or mainly in the Boston area?
I have to be licensed in this state.
Yeah, I figured that. I don't know if you can get, like, I'm a dietitian in California. There's no license, but in other states we have to actually get licensed to practice virtually. I'm not sure how that works for psychiatrists.
Yeah, well, I'm not either. Most of my practice is in person, or if it's virtual with people who are in Massachusetts.
Okay, yeah, that's what I figured. Unless you get licensed in all these states, which is
I'm trying to get other clinicians to get trained in what I call dual brain psychotherapy.
Oh, okay.
Where I teach them how to talk to the two sides, really work with that. It's a special skill you have to develop.
Oh, okay. So if you're a psychotherapist or a psychologist, I'm assuming psychiatrist as well, you can go through this training and then utilize this in your practice.
Yeah.
Oh, wow. That's really great. It's really groundbreaking. It's something I had never heard until last night. And then, this week when I was reading about it, it was really fascinating.
The other thing is there's a term in science called the effect size. And what it means is, how effective is the treatment? So if you take, say, an herb or drink herbal tea or something, it's very hard to know, whether it actually helped or not. If took cocaine, they would have a reaction that would have a big effect size. Prozac has an effect size of about 0.3, which is low.
Yes. Okay.
And our study showed in a prior study that it had an effect size over placebo of 1.5, and that's twice high. It's really extremely powerful.
Oh,
so that's good. Yeah.
That's great. Yeah. And so hopefully, do you know if there's particular other psychotherapists or psychologists, psychiatrists who are trained in this?
I'm having a hard time getting people to kind of wrap their heads around it. Yeah. And it's a little too novel.
Okay.
And, the idea of, the man with two minds,
Yes.
And so it sounds weird, but it's real.
The thing is, it doesn't sound weird, but I'm not trained in this. Sometimes people who are trained in something, it runs kind of in the face of what they've been taught, right? Yeah. So where people who are not in the field, sometimes can be a little bit more open to it. Yes, for sure.
Okay.
And you had mentioned at the beginning, it was this kind of related to those split brain studies?
Yes.
They had a surgery that cut the connection between the left and the right half of their brain.
This is how I came to this. And I was noticing early in my career that I wasn't seeing a lot of egos and ids and superegos, although I knew what they meant. But what I was seeing was that the patient would come in and be very symptomatic and immature, and then he'd become very mature and healthy, and then something would happen and he'd regress and it became like he was when he came in. And I thought it was a personality change. I reread a book from college on the split brains, and I saw that this related to what I was seeing. Now, the split brain studies are about, they won the Nobel Prize, an operation that was performed on people with intractable epilepsy. Okay. And the connection between the left brain and the right brain, the brain sort of looks like a walnut. It's wrinkled and has two halves and a stem in between. So they cut the stem. It's called the corpus callosum. And what happens is you then have two independent people. One hand wants to smoke and the other hand puts the cigarettes out. And there are all these stories. It's called a post-commissurotomy syndrome. And eventually the left brain takes over. But for about 2 months they have this. And I did a study I did actually the last split brain study in California, where I put two different words on each side of the screen, on the left visual field and the right visual field. And essentially I said, how much do you feel? And one side had the word happy and the other side dishonest. And they were positive and negative words. What we found was that in one patient, his left brain had a very negative view of himself. his right brain had a very positive view of himself. And we published that. And then the other patient had about the same view of himself on both sides. But when we were setting up the equipment, I was talking with him, and he mentioned he had been bullied as a child. And I know as a psychiatrist that that's a very traumatic experience. And I asked him if that bothered him. He said, no, it happened, so many decades ago. And so when I was testing them, I interjected 10 bully questions. How much did the bullies upset you? And his right hand, they pointed to pegs from none to extreme. And so his right hand signing for his left brain, which was speaking to me and telling me that he wasn't upset by it, indicated he wasn't upset.
Okay.
His left hand signing for his right brain, which was upset, indicated he was extremely upset. The right brain is not able to speak in split brain patients, point to different pegs and give answers from none to extreme. And it indicated it was extremely upset by the bullies, and we published that.
Oh, so his left brain, that was the healthy, mature side. And so it really was stored in that right brain, even though he didn't really remember, or he just said, oh, I remember, but it wasn't a big deal. So it sounded like maybe the side that was more mature was more developed in him, or he had just repressed it.
That's right. Yeah.
Okay. Wow, this is so fascinating. I really enjoyed this discussion.
Thank you. I did too.
Yeah. So how can people learn more about you? And I know the book is on Amazon. Are there any place that people could contact you?
There's a website called www.dualbrainpsychology.com. So that's a good place to get information.
Okay, dualbrainpsychology.com. I'll put it in the show notes as well.
It's one word without any hyphens or punctuation.
Wonderful. Well, thank you so much again for coming on the podcast.
Yeah, my pleasure. Thank you.
I really liked this discussion, and it's really interesting to me. I'm going to try that little experiment again and with another memory and see if I still get the same result. I think I will, because last night I did it and
try
today.
It with your friends. And
yes, I will do
that. The viewers should try it and try it on their friends.
Yes, for sure.
It's really interesting, and you don't expect it to work. And for some people, it won't do anything.
Okay.
About 15%.
That's right.
I don't respond, but most people do. And it's cool.
That's great. Yeah. Wow. Well, thank you again so much. I really enjoyed this discussion.
Hi, I'm Dawn Damari, host of a Teaspoon of Healing podcast and registered dietitian at True Harmony Nutrition. I just wanted to remind you that the opinions shared on this podcast, unless it's a solo podcast featuring just me, are the opinions of my guests. I do not necessarily share the opinions shared by my guests on the show. I also wanted to remind you that this podcast is for informational and entertainment purposes only. It does not constitute medical advice.